So yes, basically the idea of this 20 minutes, we will try to, we are going to present you like two concrete initiatives and opportunity for organizations who are developing AI solution and who are developing and commercializing AI solution. But before doing this, let's just introduce you and present you our organization so you know what we do, and then let's dive a little bit more in detail into these two concrete initiatives that you might be interesting to join. So Tim, if you want first, I'll let you present Anap, and I will then present Resah.
So Anap is a public agency. We have a consultancy activity. We are directly attached to the Ministry of Health in France. And we intervene in the field that is in the hospitals, but also in elderly homes or ambulatory care centers. And our mission is to support, equip and accompany health and medico-social institutions. We have three great ways of working. If you can go to the six areas of expertise. So of course, everything that turns around digital technologies, of course, care organization and health paths, investment, logistics, purchasing, human resources, medico-social performance, and economics and financial performance, which is a theme of interest at the times being. We work with about 100 in-house experts, and we have a network of about 600 now external experts, colleagues working in healthcare organizations that come working with us in the field. Three modes of actions. So the first one is to produce operational content. Second one is networking. So we gather regularly our 600 experts and more people interested in our works. And we conduct on-site missions, support and interventions in the healthcare system.
Okay, then just a few words about Resah. So Resah, we are a public interest group. We're acting at national level in France. Our objective is to support the mutualization and the professionalization of the procurement of public and private non-for-profit healthcare and social organizations, and in order to improve their individual and collective performance. So we have 200 collaborators, and we are mainly based in Paris. The main activity of Resah, again, which is a public organization, is to be a central purchasing body. So we have more than 3,000 beneficiaries. Half of them are hospital, 20% are nursing homes, and the rest is like territorial community, firefighter, etc. So you have to know that all public French hospitals are members of Resah and can buy and use our public contract to buy anything they need. We cover all the need an hospital and nursing home can have. So we have 12 procurement categories from medicine, medical devices, biomedical, IT system, etc. The procurement volume last year was 3 billion euros. So just you can have an idea of the size of the contract we have managing. We have more than 5,000 ongoing public contracts, again available for all healthcare organizations in France. And these contracts are owned by more than 1,000 suppliers, which 30% of them are startup and SMEs. So it's not that because we are a national central purchasing bodies that the contracts and the call for tender we publish are only, let's say, accessible for big company. Also, startup SMEs can, of course, get access to a public tender and submit offer and then get a public contract with us, and then so can commercialize their solutions through our public contract to healthcare organization. Just quickly, because this is not the purpose of this presentation, but so we are not only a central purchasing body, we have also many other activities for the healthcare institutions, so from consulting department with experts in logistic and procurement aspects, so who can directly intervene inside the healthcare organization on specific projects they might have. Resah Formation, so training center, which is labelized by the French state. So we have a lot of training on public procurement of innovation, logistic aspect, etc. Something important, if there is company here in the audience, we have also specific training for SMEs, for companies who want to know more on public contract, public tender, and how it works, public procurement. So specific, not to make you becoming a public procurers, but at least to better understand how it works, and so how you can better submit a better offer to public tender. Resah Edition, we publish a lot of guides which are free and available online, and so then the two department I'm leading, so Resah International, we are connected with other public procurers, central purchasing body at European level, involved in a European project in the healthcare sector on public procurement of innovation, and so Resah Innovation, which is a supporting department where our objective is to, with my team, to identify innovative solutions in the healthcare sector, evaluate them, and then work with our colleagues from the procurement department in order to launch a specific tender to buy innovative solution with so specific procedure, including the one I'm going to present you later, and specific procurement technique to make sure that these tenders are accessible for startup and SMEs who are not really used to participate in such, we can understand sometimes, administrative, long and complex process. So this is it for Resah. It was it for Anap, and so now I give back the floor to Tim, so he can present you the online platform dedicated to AI that has been developed by Anap, and then I will present you the specific public procurement mechanism we have created at Resah with the support of Anap.
So I'm going to say a few words about ai.anap.fr. So it started about 2.5 years ago. We wanted to give the sector visibility on the different solutions that are currently active in the healthcare organizations, in the different institutions we're working with. And so we decided to set up this website. So it's open for great public. Maybe you could, yes. It's open great public, so you can go and check. We have about 50 solutions referenced now. We have three big goals with this website. First one is to identify state-of-the-art solutions that are actually running in the field. So we are not speaking about prototypes. We're not speaking about a solution that's still in a testing phase. We are speaking about on-the-shelf solutions that can be deployed easily in different institutions. We want to highlight user feedback, both positive and sometimes negative. And we also want to illustrate the diversity of solutions that AI can bring into healthcare institutions. And that's one key point of our message to the sector. The dream of every AI startup is to cure cancer. That's the tip of the iceberg. But there are far more accessible solutions that bring a lot of value to healthcare organizations when you look into, well, the general functioning processes. So think about billing, think about HR, think about procurement, logistics. And so we looked for solutions in those areas that are today mature, that are easily accessible. You don't have a long regulatory process to validate your model. And that's the first message to the sector. Concentrate on those themes. And the second one is AI isn't just for big teaching hospitals. It also works in little healthcare organizations. And so when we look for user feedback, we deliberately look for small, intermediate organizations all around the country, so that every establishment receives the message that it's also for them. It's not just for the elite, it's for everyone. Of course, what's interesting is for you is how do I get on the website? So, very simple for you. There's a big button, Proposez votre projet. You click on it. There's a simple form. You fill it. Few informations. You can join your pitch book if you'd like to. Then we make contact. We have a first discussion with the startup just to ensure ourselves that there's really AI inside. AI is very bankable. Sometimes there is a AI sticker on the product, but when you look inside, not so much. So we want to ensure there really is AI inside. And then we ask you for a reference to have a talk with the client, because our entry point is the client when we publish it on the platform. And once the solution is published, of course, we share it with our friends at Resah. And we push it through our social media and through our newsletter. Our newsletter is read by about 50,000 people. Mostly, well, hospital directors, of course, but also doctors, nursing managers, etc.
So perfect. After this concrete example on how you can maybe showcase your AI solution to make sure that it can be discovered for potential end user, let me present to you, let's say, public procurement mechanisms we have just launched at Resah in May, and which will last several years. So the first step for us was to define AI category. I mean, what are the potential type of AI solution existing, or which can be used in healthcare, in the healthcare sector by healthcare organizations. So we did this work with Anap based on the work they already did also with the platform which was just presented by Tim. So after this work and collaborative work, so we have defined 3 main categories of AI solution in the healthcare sector and divided into 69 subcategories. So the 3 main categories are medical AI solution, which include, for example, like AI applied to diagnosis, predictive and preventive medicine, drug prescription, patient treatment, medical imaging, etc., etc. The second one is organizational AI solution with subcategory like AI applied to data structuring, hospital billing, report generation, etc. And the final one is the AI applied to R&D with, of course, AI applied to clinical research, clinical evaluation for therapy, etc., etc. So we did this work. You will see after. You will have the link also to download, of course, the public procurement tender, and so all of these categories and subcategories will be included in it. So first step was to do this. First, to make sure like what are and in which category like all the solutions, which AI solution existing on the market might fall, and maybe the future one. Second is dynamic purchasing system. What it is and how it works. I will try to explain it to you quite quickly and simply, but it is a public procurement technique which is included in the Code de la Commande Publique, in the public procurement codes, and which is quite relevant for the procurement of innovative solutions, especially for AI, and especially if it's used by a central purchasing body like Resah. So basically, this is how it works. First step is like the contracting authority. So a contracting authority, it's a public organization which is subjected by public procurement law, so who are obliged to launch public tender to buy product and services they need to use. So contracting authority publish an invitation to tender to its dynamic purchasing system. Then the phase one is the supplier application. So suppliers who have the possibility, the capacity to propose an innovative solution that can address the topic of this procurement procedure, submit a supplier application. The supplier will need to meet the eligibility criteria which are defined by the contracting authority. These eligibility criteria are not related to your solution, and they are related to the company itself. You will see with the Resah example later. But what you have to understand, this is the big difference between the dynamic purchasing system technique and a classic call for tender. In a classic call for tender, we launch a call for tender. We have specification. We invite the company to submit an offer. You have like 2 months to submit an offer. After the 2 months, we evaluate the offer. The best one win. We sign the contract with the company, and then the contract is available is signed for the next 4 years maximum. So there is no competition anymore for the coming 4 years. With the dynamic purchasing system, this phase one and the phase two later remain open for the whole duration of the contract. So we have published this in May, and you can still participate and submit an application to this phase one, you will see later. And you will still be able to do it next year, in 3 years, in 4 years. This is why it's quite relevant to use this kind of procedure for the buying of AI solution, because AI is in constant evolution. There are new solutions which are available on the markets every year. So launching a classic tender with just like 2 months to submit an offer and then having a contract for the next 4 years will not give up the possibility to have the new potential AI solution. Then, if you met the eligibility criteria in the phase two technical offer, then we invite the pre-selected company to submit a technical offer based on a specific need. So at that time, only companies that will have been selected in phase one will be invited to submit an offer, technical offer at that time, to say that my solution, my AI solution, can address your specific need in this specific topic. So we do this mini competition. At this moment, we evaluate the offer we receive from this pre-selected company. And the one who wins the contract will then be able to sign this specific contract and so be able to execute the contract and then commercialize his solution with the healthcare organization. I hope it was clear. I know it's already not that easy to get in French, and not that easy when you are in the field. So in English and in 2 minutes, it's even harder. But this is the combination of the 2 previous slides. So this is the Resah dynamic purchasing system for the procurement of AI solutions that we call alias, so achat de logiciels d'IA en santé. So it integrates the 69 subcategory I mentioned before. Then the eligibility criteria for the phase one, the supplier application I just mentioned before, are this one. You need to have a mature, commonly used, and off-the-shelf solution. You need to have a solution which comply with the EU AI Act definition for what it means. You need to have at least 2 cell references inside healthcare organization. Again, we are a central purchasing body acting at national level in France. We cannot just select solutions which are still under development and which still need R&D. We need to have solutions to propose to healthcare organizations that are already working and that are available. So you need to prove that you have already 2 cell references in healthcare organization. And finally, the last eligibility criteria is having a minimum turnover of 40,000 K last year. If you developed an AI solution, and if your AI solution can fit in one of the 69 categories, 1 or more, you are invited to go on this website, which is Maximilien, to download the tender specification and so to submit your company, this is how I call it, supplier application. You just select the different AI category. You have an innovative solution that can address this category. You just prove that you can meet the 4 eligibility criteria, and you will be pre-selected into the category you have selected. Then, how we are going to use it? 2 options. There is an hospital in France who want to buy an AI solution which is in one of the 69 categories. They will contact us to get access to this procedure, and they will put into competition the pre-selected company of the category of their choice. And then you will be invited to submit a technical offer, and the best one will sign a contract with this specific hospital. Second option, Resah, as a central purchasing body, will create the choice of Resah. For each of this category, we will launch our own mini competition. We will select the best solution for us in all of these 69 categories, and then we will make this specific contract, Resah specific contract, available directly for the hospital, so they will not have to do this specific work. These contracts will be available for 4 years plus 3 additional years. So again, this is open for all of you to submit supplier application for the coming 4 years and maybe additional 3 years. To do this, you need to go on the Maximilian platform. Maximilian platform, which is a tendering platform where we launch all of our public tender, and you can just find for alias, use these QR codes, and so you can download everything, and you will have all of the information to submit your offer. Basically, that's it, and I see that we are already out of time. Thank you very much, and yeah, that's it.
Thank you very much. Let's give them a round of applause.